Gabriel Diadapan, and I'm your physical therapist for today. So in today's session, I'd like to verify first for your name and your birth date.
My name is Vincent Teresa. My birthday is September 1963.
Okay, so Ma'am Cynthia, how do you feel today? Okay, that's good. So now, Ma'am Cynthia, I'd like to review you on your case lang ha. So, you've complained sa assistant na po na you are having a problem with your left foot going inward. She noted that this is a sprain, and what happened to this is that you were playing jumping rope with your grandchild. Is that true? Okay, that's good. So, now, gitake ka og pain scale last time. And 0 to 10 siya. And you said na 6 in pain, meaning severe. I'll be asking you, unsa imong pain scale today? If you mo na i-move. 0 to 10. 0 as no pain, 10 as first possible pain.
6. Severe and
Severe. Okay, that's good. So, no, that's not good. That's bad. But like, at least in the same siya sa data. So now, ma'am, you know na dili normal range imong kuansa. Okay. So, what we'll be doing is I'll be doing a therapeutic exercise. Pero before it, I'll be doing a contraindication first. Meaning na this will be the possible risk. This will put the exercise at risk. Yeah, we don't want sad to harm you. So, I'll be asking mga private questions niya, and I want you to be as honest as possible, okay? Okay, so, now, ma'am, I'd like to ask, are you hardcore mobility? Okay, that's good. Did you have surgery prior to this meeting or like 3 years? Okay, that's good. Do you have any conditions like arthritis? Okay. Do you have any sign of edema or swelling or inflammation na nakafeel kay ginit sa imong leg? No? Okay, that's good. So now, ma'am, I'll be doing the therapeutic exercise, but I'll explain to you first. Ang therapeutic exercise is called the subtalar medial glide and lateral glide. For the subtalar medial glide and lateral glide, this will help you improve your range of motion, and also it will help make the joint more flexible, and hopefully it will heal the tissue that might have been damaged inside. Okay? So okay, Rakat, to do that exercise, ma'am? Okay. So in this exercise, I need to come in contact with your body. Are you fine with that? Okay, that's good. So now, ma'am, before anything else, I'll be getting your vital signs. So for me to get your vital signs, I have to know your baseline first. So I'd like to ask for your baseline, ma'am. Assuming that patient has given me her baseline and that I've taken all her vital signs and everything are in normal range, we have the most important thing in the vital signs with patient. Taking consideration that patient is an elderly woman, for me, everything are very important. So, I will now proceed to that therapeutic exercise. So, here is my vital signs materials. So, I will now proceed to the therapeutic exercise. So, for the therapeutic exercise, ma'am, what I want you to do first is, please lie on your back. Higda lang sa higanan. And then, please, pakilit ka higda, ma'am. Yes, affected area lang. Okay, that's good. Then this, that's good. So now, ma'am, the patient's capsular pattern for this technique is limited range of motion medially and laterally. And then for the open pack and resting position, it will be midway between the inversion of a reversion. So in the therapeutic exercise, I'll be keeping my pinky finger and my thumb on the patient's back, talus. This is to stabilize the leg. Upon stabilizing the leg, I will now place my hand on the surface area of the feet of the patient, and I will be moving it inwards, like this. I have to do this gently, taking consideration that patient is grade 2, meaning that patient has a strain in the muscle. So, I have to do this gently, and assuming that I've done this for 1 to 2 minutes, I'll be asking the patient's condition. So, ma'am, how do you feel about the therapeutic exercise? Good. So, assuming that patient has a condition is good, I will proceed to oscillation, which is grade 3. So in this position, I'll be asking the patient the same thing. I'll be asking the patient to move this way, or you can do this in a prone position. But in this case, we will lessen the movement of the patient. So I will ask the patient, I will move the patient's feet like this, and then make a movement the same thing. The same thing, but this time, I have to consider the condition for grade 3, which is for the grade 3 oscillation. What happened is that there is a large amplitude for rhythmic oscillation, and then there is a stress on the tissue inside, and then this will be at the limit, form up to the limit of the range of motion. Yeah, this will be done 2 to 3 per second. Yeah, 1 to 2 minutes. So it will be like this. So this is the end of the limit of the range of motion. This is the beginning. Yeah, if patient feels pain, I will go to grade 1. So for grade 1, what happened is this. This is a small amplitude. For the small amplitude rhythmic oscillation, what happened for grade 1 is that it will be performed sa beginning ra sa range of motion. So there is a manual ra siya na vibration. Di siya rapid. Rapid siya oscillation, but like not the same as grade 4. So for grade 4, the same siya, small amplitude rhythmic oscillation niya are performed this time at the limit. So kani beginning man tong grade 1, kani limit na ni siya of the available motion. So it will stress into the tissue resistance. Yeah, what happened is rapid oscillation, yeah, manual vibration siya. So resistance naman siya, so grabe siya gaana. So now that I've shown you all the oscillation grade, I will go back to patient and I will do my closing remarks. So ma'am, we're done with the treatment session. Please stand up. Do you feel any dizziness, ma'am? No. Right. Okay, that's good. So, ma'am, I'll be getting your vital signs for one last time to check if okay or difficult condition. Yeah, assuming the patient's vital signs are still the same, I will not be doing my closing remarks. So, ma'am, thank you so much for your cooperation today, and everything was going according to how we see it. I hope to see you next time in our session. Thank you so much and have a good day, ma'am. Thank you. Okay.